Hello, Team Chesterfield. My name is Tim Bullis, and I work with the Communications and Community Engagement team for Chesterfield County Public Schools. We appreciate you stopping to take a look at this video today. We have with us our superintendent, Dr. Merv Doherty. We just want to share some updates and ask for some help when it comes to making sure that we have a safe, supportive, and nurturing learning environment for when our students eventually return to in-person instruction. So Dr. Doherty, thank you for joining us today.
Glad to be here, Tim.
So let's get right to the heart of the matter. In order to get numbers down and to keep people safe, they tell us that we have to wear our masks. I'm assuming masks are going to be required, and what can parents do today to get prepared for, help their children prepare for at least the return to start school?
That's a great question, and we are mandating masks for all people, students, staff members entering the building, but also on the bus. And parents can, if they haven't already, start having their children wear masks. We should all be wearing masks when we're out in public. But you know, when you think about how a day starts, getting on the bus, you will be wearing a mask on the bus. If they don't have a mask, our bus drivers provide them, but they will not let them ride the bus without wearing a mask. Now, we know there are medical issues that we will deal with. But as you walk in the building, as you're in the building throughout the day, you'll wear a mask. Now for elementary, when you have recess, you're outside, a little different. Lunchtime for everybody is a little different. But the issue for us is that you will wear a mask for the safety of yourself and for everyone else around you.
How can parents begin to prepare their students for that right now?
A couple things, like I said, wear a mask when you're out and about. I'm sure they are. But also is start going through the checklist that we provided, and we're going to provide multiple times through our office and through the school's offices, of the 4 points to look for. And getting our children used to that. There's no reason to be worried about or scared, but we're not going to do temperature checks for every child every day because the CDC says that's really really something that doesn't have a big impact, even though we see people doing that, because a lot of people who may have contracted the virus don't have a temperature. And so they're saying it's a false sense of security that you're having here. But we know that we will be checking temperatures during the day. We know that people will come down and say, I think I'm feeling bad. And especially when you think about in October when flu season begins, we'll be dealing with that as well. So I think our parents can right now begin to look at that checklist, go through it. And it's a great checklist that's provided by the CDC to say, here's some things to look at, 4 points, okay, we're ready to go. Not a bad idea to do it. We're going to do we're asking our adults to do it. We're asking our parents to do it for their children. And it's probably a good idea to do it every day before you leave the house.
The checklist, which will be sent to parents, includes questions like, do you have a fever? Have you been exposed? Do you have any symptoms that are new to you? As we get them onto a school bus and get them into a school, a student who had not had any issues previously but starts exhibiting symptoms when at school, what are we going to do to make sure that they're safe from the regular children who need to access the clinic anyway?
Great question. And we've been given very good guidelines from the health departments and across the board from the CDC. But if they get to the nurse and they have a temperature and they see the symptoms, we have isolation rooms established in each areas. We will then contact family members and let them know that their child is in the isolation area. There will be someone with them during that time period. However, immediately we will start tracing where the student was and how many people they were around for how long. That's the key, is for how long they were around people. Hopefully our social distancing will prevent a lot of this from occurring. It's going to happen. There hasn't been a school open yet that has happened. You haven't think of the colleges that are open and are closing immediately. But that's not our goal. Our goal is to keep it safe, do it right. We have nurses and clinical assistants that are outstanding, and we're in this together. So we all need to participate in practicing the safeguards, and we have to realize that, you know, we only have the children for 7 hours a day. So are they practicing good, safe, habits at home, and are they on the weekends? Are people keeping their social distancing? It's okay to be around people, but wear your mask. And really, we're just trying to give a better awareness of good health. You know what we're trying to do. We understand the hand sanitizers and the washing of hands and sanitizing hands, and we're preparing for that. But this is a team effort by everybody in Chesterfield.
So in the past, when a child has woken up and may have had a slight fever, 100.1 degrees, maybe the parent gave them two Tylenol and sent them on to school. We're asking parents not to do that this year, because if a child comes with symptoms and is positive and spreads, obviously we're not just talking about one child who's impacted at this point. We're talking about quarantining several teachers, 24 students, really a disruption to the learning environment.
Absolutely, and it's really, we need to start respecting others, which is I think a challenge for our society right now. And so we just cannot think about my child. We have to think about the children in the classroom, children on the bus, the people they're going to meet, that we need to be responsible. I need to be responsible. Parents need to be responsible. Teachers need to be responsible. People are going to have temperatures. People aren't going to feel well. And we have to realize that. And sometimes it's just they don't feel well. They have a temperature that happens to children. But again, we're respecting others and the health of others.
So I know the doctor in front of your name is more from an educational component than a medical component. But if a child exhibits symptoms, talk about and then spreads them, it really becomes more of a disruption to the family if we begin a yo-yo type concept where you're in 1 week, out for 2 weeks. We'd like to make this as stable as possible moving forward.
Absolutely. And people realize that to be out there 2 weeks, you're going to be more asynchronous learning, some contact because it's more of a home environment now. But it also affects the family because now the family is also quarantined. So it's not just the child, but under the health guidelines, everyone in that family is now quarantined because they've been exposed to that student, and they're out for 14 days, and people that they've come in contact with could be out for 14 days. So the domino effect is severe, and the faster that we can get everyone on board to follow strong health habits, the better we are.
So the mortality rate isn't the bigger concern, it's with how quick this disease spreads and transmits from one person to another.
Yes, and I'm glad you brought that up because, early in this process, everybody kept saying, well, children don't get this, it's not serious. Well, the one big issue that nobody wanted to bring up was that we weren't in school. We closed schools down before the epidemic or the pandemic went through the system. If we'd have stayed a couple of weeks longer, it would have been a big hit for us. So now that people are starting to go back to school and you're starting to see less social distancing, they're starting to see all students can get it. And by the way, students can transfer it a lot quicker, and sometimes they get it more severe. And so everybody wants to look at death rates, but it's not the death rates of children, it's the long-lasting effect it has on them in their physical bodies.
So let's talk about what we're going to do to keep the learning environment safe and clean. What are some of the processes and procedures we have in place regarding cleaning?
During the day, we have multiple cleaning teams. They'll be in the building, wiping down everything. We have cleaning solutions and wipes and sanitizers in all rooms. At the secondary level, students, before they leave, they'll wipe down their desk. That's their germs, that's them. That's a safe thing to do. That's a recommendation. We're not going to have somebody come in and clean everybody's desk. That doesn't make any sense, where I can take a disinfectant wipe and do it and do just as good a job. The opportunity to make sure our bathrooms are clean all the time. The night crews will be sanitizing and cleaning. That's why we're taking Wednesdays to do clean, and on Saturdays we'll do the same thing. So just because we're closing a building down on a Wednesday to do some cleaning doesn't mean it's not being cleaned on the other 4 days. The things we're trying to do with PPE, with shields, with face masks, with gloves, with gowns, with all the disinfectants that we're trying to put in the buildings, with changing air filters in our systems to make sure we have MERV 13s, to make sure that the HVAC units are running correctly, the heating units are running correctly. What we don't control is a change of weather. And we're getting ready to go from September into October into November, which causes 3 different temperature climate changes for us, and other things happen. But I think our health people, our nurses, the health staff, the cleaning crews, the custodians, everybody has an awareness how important it is. And I think that's the biggest hurdle to get over, that we understand the dedication we need to clean our buses. You know, when you think about the end of the run, how to wipe the buses down and get going again. But the key is if people wash their hands regularly, if they wear their mask, we are in a lot better shape.
Let's go back to the HVAC topic that you broached very briefly. That's been a source of questions for some parents. We have some aging schools, that's no secret. We did just cut ribbons recently on 3 brand new schools, but the average age of our elementary schools is in the 40s. Same with same with middle and high schools. What you talked about MERV, that's not you, that's an actual filtration system. Talk a little bit about what we're doing to make sure the air quality in the buildings is good.
Well, just recently, this hasn't been, MERV has been out there, the different levels of the thickness of the pad. We usually use 6 to 7. We transferred over a little while ago to 10 to 11. We're going to go to MERV 13s. And so everywhere that the systems can push the air through the MERV 13s, the other ones we are updating. The Board of Supervisors have been outstanding. They have been supportive. We are getting additional funding for preventive maintenance and to look at what we can do to help with the air quality of a building. Not that it was bad, it's just the pressure that MERV takes to push through the air, and also looking at every area that we have to improve. They're working on it as I speak, and with changing the filters, making sure that not our buildings are clean, they're sanitized, but that the systems go through. And we are going to have systems that break down, and we've had even this summer where the part of the system was down, the rest of the system was working, and getting that fixed immediately. But from the county standpoint, helping us and helping with procurement and getting things done, I think everybody's on the same page, and that's a good feeling in Chesterfield. And people of Chesterfield should feel comfortable that the county, Board of Supervisors, the school board members, and Dr. Casey's been fantastic. He's been a big help to help with my office and things that we're doing. And we're just going to continue to do what's best, do what's right, and keep safety first in our families.
So safe, supportive, and nurturing is a tagline we've used, but moving forward, it continues to be an everyday expectation, and it sounds like whether it's through the health self-assessment, through mask wearing, through cleaning your own desk, to self-reporting if you're not feeling well, everybody has a role to play in cleaning, and everybody has a role to play in building this safe, supportive, nurturing environment.
Absolutely, and we're going to be providing videos for families just to preview on like bus to bus, like what I do to get on the bus, go through a school day, get off the bus, how to do different things in the building. I know our health people are going to do video on just the health aspects of this. So we are trying to hit every aspect that we can, make sure our parents understand what's going on. I'm not here to change anybody's mind on to come to school or stay virtual. That's a personal decision, and I commend them for that. Those who want to come to school, we will do our very best to educate to the best of our ability, to keep children safe, and to do the best we can. For children who are staying home, we will do the exact same thing. As we've talked to everybody in our system, we're going to treat this as a normal school year, knowing that we're doing it by the screen until we see you in person. And some may be on the screen all year. And so we have to realize that as well, that we are committed to providing a quality education anyway, in any avenue.
Everyone has a role to play in that.
Yes, and it's really an equity piece, that we have to make sure that all of our children are being contacted, that we're doing our social emotional lessons, that we are doing the best we can to making sure they're moving forward in their academics.
So families, if you haven't already, please start your child wearing masks at home, not just outdoors when you're out in public, so that they can begin to get used to sitting in a classroom setting for that eventual return to public instruction. Please make sure that they are following proper hand hygiene, they know what the symptoms are. Help us help you, help us keep our children in school. And with that, we thank you again for joining us for another round of Engage Chesterfield. We appreciate your continued support of Chesterfield County Public Schools. Have a great day.